Hey, it's Mo Egger. If you love sports, man, this is a great time of year. You've got college football, the NFL, and of course, college basketball. And there's no place to watch all the games than Long Neck Sports Grill. 3 locations in northern Kentucky, Wilder, Hebron, and Richwood. They've got 4K TVs all over the place with the sound on for all the big games. Plus, the menu is fantastic. You've got to try the wings, and no place has a better beer selection. Long Neck Sports Grill. Stay late. Come often. Let's talk injuries. I think most specifically, Jonah Williams. We have done this every single Wednesday. We talk injuries with one of the experts at OrthoCincy. The great thing about OrthoCincy, specialists and locations all across the tri-state, and they also offer walk-in orthopedic urgent care weekdays from 9 to 9. That's right, 12 hours, 9 to 9, and Saturdays from 9 to 1 for your convenience. Learn more at OrthoCincy.com. That's OrthoCincy.com. Joining us this week, Dr. Nick Early from OrthoCincy, also the school physician for Turpin High Athletics. I appreciate the time. Lots of questions about Jonah Williams. He left the game with a dislocated kneecap on Sunday night. He suffered this injury, similar injury earlier this year to the other knee. In that game, he came back. On Sunday, he didn't. So explain to me what would make this particular injury he's dealing with now more severe than the one he dealt with back in October.
So there's a couple things that are interesting about this. So for the most part, we're talking about this type of injury, which we'll call a patellar instability event or patellar dislocation. The kneecap can go either part of the way out or all the way out. And there's a couple factors about somebody that can actually make it sometimes more or less traumatic. It can also potentially, some of these underlying factors can also make somebody prone to it. So some people are just very prone to it because of the alignment of their knee and their leg and some other factors. And so he may be one of those people. And in this situation, if this is potentially even the first time or it's been a while since this has happened to this knee, then sometimes there's more trauma to the soft tissues that kind of hold that kneecap in place. And so you may have more swelling or, some more things that may keep them down a little bit. Now, in addition, there are some other things to be concerned about when the kneecap goes out of place, such as cartilage injuries. And so sometimes that can potentially complicate things a little bit too. So it can vary from incidence to incidence. But certainly it's somewhat concerning since he's had it, going on with both knees.
Yeah, both knees. So is that, do you chalk that up to coincidence, or is this maybe a sign of a bigger issue?
So I would, I would somewhat be concerned that he may have some of those underlying alignment issues or some other things that may make him more likely to have this. Now, it could just be a freak thing that it happens. If it's a recurrent problem, you can try to treat them non-operatively initially and, brace somebody and get them moving with physical therapy. If it's a recurrent problem, then sometimes there are surgical procedures you can do to try to help stabilize things.
What are the typical treatments for a kneecap dislocation?
So initially, you usually start out with just trying to get the swelling out, oftentimes starting with a brace, doing some physical therapy, and seeing how somebody does. If somebody has recurrent instability and their kneecap keeps coming out or they're just not able to get back to their level of activity, then it can progress to the point where sometimes you will do surgery. And what you would do would vary depending on the circumstances of their issues.
They play on Sunday. If they win, they play the following Sunday. If they win that one, they play 2 Sundays from then. Are we talking about an injury that he could at some point, if not this week, still find a way to come back and play despite it still being a lingering issue?
Yes, so it is possible. He may be at a higher risk for potential recurrence, but it's possible, and it is kind of a week-to-week thing sometimes, and it depends on the amount of swelling that there is in the knee and also what kind of control there is of the quad function, the muscle function of the knee, just to see is he going to be able to perform at the level that he needs to.
Dr. Nicholas Early from OrthoCincy, OrthoCincy.com. I want to ask you about a pair of Buffalo Bills wide receivers. Isaiah McKenzie suffered a hamstring injury last week, didn't play in their game against Miami. We'll see if he's good to go this week. Kind of a two-parter here. Number one, what sort of tests would he have to clear in order to be good to go for Sunday? And then I guess the other thing, given the fact that it's Buffalo, and it's cold. It's January. How much could the weather complicate his return?
Yeah, so just to start with that last question, I do think that when it's cold, it's definitely harder for athletes to get warmed up and make sure that they're not going to tweak something. And so certainly if you're coming back from a strain type of injury where it may already be tight and have some soreness, they'll definitely want to really be focused on getting him warmed up if they're going to try to get him back there at all. In terms of those types of injuries, what you're looking for is for somebody to really have good strength, their ability to move explosively, do everything they need to do. And that really kind of depends on their, what they're able to perform functionally. So you really kind of see, okay, can they jog? Can they run? Can they jump? Can they do the things that they need to do? And then you really move into those sports-specific activities and stuff. Say, okay, can you push off and cut? And so that's something that their training staff would, have to kind of be assessing, day to day to see how he's doing. And there's certainly a lot of treatments you can do to help with the symptoms of a strain injury like that. And sometimes it just takes more time, but it's really, it's hard to predict.
I want to ask you about another Buffalo wideout, Jamison Crowder, who hasn't played since week 4, broke his ankle. He could go this Sunday. They're at least open to that possibility. He has been practicing. His injury history to me is interesting because lots of lower body stuff. He has missed games in his career due to injuries to calves, his groin, hamstring, and now his ankle. This is maybe a dumb question, but is there any chance those things could be related? Or do we add those things up and are they a symptom of a larger issue?
Once again, it's kind of hard to know exactly. Sometimes, especially when there's soft tissue injuries like a strain to the groin or the hamstring or something along those lines or calf, that could be associated with, either not being warmed up, appropriately, or maybe he's just really tight or something along those lines. When you start looking at multiple bone type of injuries or stress injuries or fractures or things along those lines, then you start worrying about things like a vitamin D deficiency or things that can, accompany those types of injuries. However, most of the time it's just coincidence. Football's really tough, and so some people it seems like just have bad luck. So without looking further, it's hard to say for sure. I think that him coming back from this injury will be it'll be interesting to see what his performance is like, just because it takes time for everything to heal up, and then also to get yourself conditioned and back to really performing well.
When you're coming back from a broken ankle, what are some of the complications that could present themselves as you try to make a return?
So first off, everything has to heal up, and it sounds like that's probably going fine for him. Then it's a matter of kind of getting your strength back, your explosiveness, making sure your range of motion is what it needs to be, so that you could do those really demanding activities that you have to do in football. And that can take time. You can just get a lot of fatigue, you can get some swelling, soreness. And so sometimes they have to be really aggressive about treating some of those symptoms as somebody's really pushing themselves to get back to a high level.
Awesome stuff. Great insight. I appreciate the time, Doctor. Thank you so much.
All right, you're welcome.
All right, Dr. Nick Early, OrthoCincy. I say this all the time. The great thing about the people at OrthoCincy, specialists in locations all across the tri-state, including walk-in orthopedic urgent care, weekdays 9 to 9, 9 a.m. to 9 p.m., and also on Saturdays from 9 a.m. until 1. In Edgewood and Eastgate, it is definitely easier and most definitely cheaper than going to an ER when you've got an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. If you love sports, man, this is a great time of year. You've got college football, the NFL, and of course, college basketball. And there's no place to watch all the games than Long Neck Sports Grill. 3 locations in northern Kentucky, Wilder, Hebron, and Richwood. They've got 4K TVs all over the place with the sound on for all the big games. Plus, the menu is fantastic. You've got to try the wings, and no place has a better beer selection. Long Neck Sports Grill. Stay late. Come often.